Hey guys, welcome to the Friday Live here at Sprouting Health in the Hunter Valley. I'm Dr. James.
Dr. David here.
So today we want to talk to you a little bit about musculoskeletal pain and how it might impact on your adolescent or your child's ability to perform at school. So when we take into account reasons why they might miss school, you exclude laziness, which is it's there. We start looking at things like pain, depression, anxiety, performing poorly at school itself. Some of the more common reasons as to why they might miss school in the first place. So there's been a recent study that said up to 1 in 4 kids are really struggling with their performance at school as well.
Yeah, 100%. So according to the Australian Curriculum Assessment and Reporting Authority, the average attendance rate for teenager in between years 7 to 10, the average attendance is about 90%. So this is a pre-COVID stats as well. Sometimes being a teenager could be quite challenging, facing different difficulty, different tasks during the day and at school. So a really sort of normal or excellent brain function is really, really important. And what we are talking about is the executive functioning. So recent research found teenagers with a chronic musculoskeletal pain have poorer executive functioning.
Yeah.
And what does that mean?
So when we use the term executive functioning, we're looking at the idea of our ability to focus and function. So if you're think of a car that gets bogged, it will spin its wheels, it won't move anywhere. Or a computer that's got too many functions trying to run at the same time, it'll just crash and stop. So it can really impact on your child's ability to focus at school, be able to switch between tasks, and to, I guess, retain that information as well. Simply put, we can start looking at the idea of how it'll impact on being able to I guess get those task switching moments done, look at how they're able to interact socially as well. It'll impact on that, and also it'll change that impulse control, so they become really impulsive, which is something really commonly seen in teenagers too.
Yeah, I think even adults, right? So
yes.
If you get really stressful, then you get a bit of an impulsive response as well.
Yep.
Does it make sense? Now, we're looking at pain and brain function. So what can cause some of the risk factors that can cause the teenager resulting in pain? Actually participating in sport, it have a higher chance that your teenagers can result in injury, such as ankle sprain, which is quite commonly that happen as well. Some more interesting factors is negative emotional status, and we also have higher BMI, a taller height, smoking, and being a female gender. It's one of those risk factor that can develop some sort of musculoskeletal pain. So in Sprouting Health, we aim to help people perform at the best. So if your child, if your teenager at home often refuse to go to school and struggling academically, experiencing difficulty to focus, so concentration, maybe they're in pain, and talk to one of us and see how we can help them perform a little bit better.
Absolutely.
Yes.
All right, guys, have a great week. We'll see you next time.